And now it's time to relax. Just allowing your eyes to drift closed. Really noticing how comfortable that is. To just simply allow your eyes to close. Letting that be the signal to your mind to release any worries, fears, stressors that you might have been holding on to. Just letting it all go the moment your eyes close. Releasing and relaxing more and more. Letting yourself drift down further and further into the soft mist of your subconscious mind. And with every inhalation, I want you to feel and envision yourself breathing in peace, calm, comfort. And with every exhalation, I want you to release, to breathe out any and all fears, worries, and tension. Just letting it all go, drifting deeper and deeper within. Feeling your body settle, sinking down into the surface below, letting it all go, coming into the present moment, surrendering to peace and calm and stillness. And now I'm going to count from 30 down to 1. And as I do, I want you to envision, to sense, to feel as though a warm, euphoric liquid is being poured into the top of your head and is slowly flowing down every nerve, every cell, every muscle of your body, taking you into the most blissful, euphoric state that you have ever known. Feeling that beginning to happen now at 30, 29, 28, 27, 26, 25, 24, 23, 22, 21, and 20. Feeling more and more euphoric. 19, 18, 17, 16, 15, going deeper. 14, 13, 12, 11, 10, going deeper and deeper still. 9, 8, 7, 6, 5, 4, 3, 2, 1, and 0, deep in the core of your subconscious mind. Very good. And now I want you to envision or just sense now that you are floating up and out of your body, floating up higher and higher, looking down on your body, gently resting below as you safely float up higher and higher, higher and higher, until you are floating up in the stars, gently drifting in the cosmos, so safe, so secure, just taking in the wonders of the dazzling stars and far off planets sparkling around you, taking it all in. And as you do, as you observe these stars, you notice that one star is brighter than all the rest, and you're drawn to it. You float closer and closer, closer and closer until you're floating right in front of it. It's a giant orb of beautiful golden light, and you realize that it is the loving core of the universe. It invites you in, and you float into its core, absorbing its pure, loving light, feeling and knowing that all is right with the world, even if it doesn't always seem so. As you float in the loving core of the universe, you know that everything is right with the world, that you can rest and relax and just be. And as you continue to absorb love and light, you realize that this loving core of the universe is allowing you to absorb protection for you and your baby. Protection from fear, from harm, from anxiety. Even after you float out of this light and eventually come out of this relaxation, you will still be glowing with this light. It will stay with you always. And in addition to this loving protection, the light has the power to transfer you anything and everything you're wanting more of in your life. Energy, hope, success, more organization, lightness, romance, anything at all. This light can attract into your existence. Taking a few quiet moments now to silently tell this loving light what you'd like more of in your life, and you feel it being attracted into you by this light. Good. It's now time to float out of this light, but know that you can return here at any time. All you have to do is close your eyes, count from 10 down to 1, and envision yourself floating up and out of your body into the stars and being embraced by this beautiful, loving light. Good. But for now, we're going to gently float back down to earth. And I want you to envision now that you are floating above the hospital where you will have your baby. We're going to witness now a beautiful, positive, gentle Cesarean birth. I want you to decide now if you'd like to see yourself and your baby moving through this Cesarean birth. But if you think that might be triggering, you can envision another woman and baby moving through a gentle C-section. Taking a moment now to decide. Good. And so now, as you continue to float above the hospital, I want you to notice that you're surrounded in a soft mist of golden light. It makes you feel euphoric and calm, and it protects you from feeling any anxiety or fear as you watch this gentle cesarean birth in your mind. Instead, you'll feel calm, empowered, prepared, and even a sense of excitement as you watch this gentle cesarean birth. And so you float down now into the hospital, into the OR, floating above, and you watch as yourself or the woman that you are envisioning signs the legal consent for the surgery. She looks calm and happy, ready to meet her baby. She's at ease, her shoulders are relaxed. And as you watch everyone in the operating room prepare for the birth, you're comforted by the fact that the care providers that will be guiding the cesarean birth, they are trained professionals that will keep mother and baby safe. You feel a strong energy of trust fill you as you absorb this awareness that you can trust the care providers in the operating room. The people here know exactly what they are doing. They know how to keep mother and baby safe. Good. Okay, now you see yourself or the other woman that you are envisioning in the operating room with their birth companion who fills mom with even more calm and comfort. The mom feels completely supported as the birth companion holds her hand. And now you watch as the anesthesiologist begins placing the epidural that will cause mom to not feel anything from the waist down, with the potential exception of a little bit of pressure. And so you watch now as very calmly the anesthesiologist numbs the lower portion of mom's spine where they'll place the epidural. The mom stays calm. She can barely feel the small prick of the needle. And now that the area is numb, the anesthesiologist slowly, calmly, safely inserts a needle that has a small catheter attached to it. They easily get the needle into the ideal position, and then they pull it out, leaving the catheter behind to deliver the epidural medication. And during the placing of the epidural that was easy and quick, mom was able to stay completely still and calm. Now that the epidural is placed, the medication begins flowing into mom's body. It fills her body with a welcome and comfortable sense of numbness from the waist down. And after the epidural is placed, mom's bladder is drained with a catheter, and an IV is started to administer fluids or any other additional medication the mom might need. She might also receive an antacid to neutralize stomach acid, and some antibiotics to prevent infection after the procedure. Again, you notice that everyone in the room, especially mom, is calm and smiling. And that same beautiful glow that you saw in the loving center of the universe is present in this room. Everyone and everything is gently glowing. Good. And now that mom is ready for the cesarean birth, you watch as a screen is raised at mom's waist. She's laying on the operating table, smiling at her birth companion, excited to meet her baby. Very good. And while some cesarean births involve the mom's arms being strapped down, this is not the case in this cesarean birth. Mom's arms are free to move, and her birth companion gently strokes the back of her hand. And instead of an oxygen mask, she's receiving oxygen through something called a nasal cannula. These are like two small plugs that can rest inside the opening of mom's nostrils and deliver just the right amount of oxygen. Good. And as the surgeon preps the lower abdomen with antiseptic, you notice that peaceful music is playing in the room, and everyone is smiling and focused on Mom. No one is having personal conversations. And as the surgeon makes a small horizontal incision above the pubic bone, one of the nurses tells Mom how exciting it is that she'll be holding her baby very soon. And then they gently cut through the underlying tissue and very gently separate the abdominal muscles. They're taking great care. Mom is feeling calm and comfortable. And when the surgeon reaches the uterus, a horizontal incision is made in the lower portion of the uterus, and the screen between Mom's waist is partially lowered, and she watches as the doctor very gently brings the baby up and out. The placenta is then removed after the baby. And now watch, the beautiful, healthy baby is placed on Mom's chest, and the two of them immediately begin to bond. The surgeon tells Mom how amazing she and the baby did, and that everyone is healthy. Everyone in the room is smiling and congratulating the Mom. And she is overcome with love and joy and feels incredibly satisfied by her birth experience. And as Mom continues to bond with baby, the surgeon applies absorbable stitches to the uterus and then stitches or staples the abdomen. The incision is usually so low that a bikini bottom can easily cover the scar. And after the C-section is complete, Mom starts recovery. She and baby say goodbye to the people in the operating room, who again are so happy for them, and they settle into a recovery room. Mom is still feeling pretty numb from the waist down, and the catheter stays in place until she can walk to the bathroom. We watch now as Mom begins to breast or bottle feed the baby. They're already bonding, they're settling into an easy rhythm. And the birth companion also bonds and offers support. Good, just watching that connection, observing the love. And after Mom and baby have had time to connect and rest, a nurse supports Mom in walking around a bit, getting the blood flowing through her legs. And during this time, it's very normal for Mom to feel a bit of cramping as her uterus shrinks back down to size. And she might have a bit of discomfort at the incision site, but her care provider will work with her to find the best pain management solutions. And now you watch as the Mom continues to heal over the next 4 to 6 days that she's in the hospital. She's continuing to get to know her baby. She's allowing others to take care of her. She's accepting that help and care as she heals. Very good. Just really soaking in how gentle and happy and peaceful this experience can be. And as you float away from the sea of the gentle hospital, cesarean birth and recovery, you're filled with an amazing knowingness that a cesarean birth can be an incredibly gentle, positive experience. You also know that women who have a cesarean birth are just as extraordinary, strong, and brave as women who have vaginal births. There's not one right way to give birth. Whichever way feels safest and best to the unique mother is the right way for her. Taking a few quiet moments now to enjoy the revelation that a cesarean birth can be an amazing, empowering experience. Very good. I'm now going to count us up and out, back into an invigorating space. However, if you are in a place where you would like to drift off into a nap, or you are falling asleep for the night, I would like you to ignore the following messages and just allow yourself to drift down into a deep, restorative sleep. Good. But if you are in a space where you are ready to come up and out and continue on with your day, I'm going to count from 1 to 5. On the count of 5, you will be wide awake and feeling invigorated. 1, taking in a deep, powerful breath. 2, wiggling your fingers and your toes. 3, having a deep knowingness that if you need a cesarean birth, it can be a beautiful, gentle experience. 4, feeling deeply connected to your baby. And 5, whenever you are ready, eyes open, wide awake. 1, 2, 3, 4, 5, eyes open, wide awake.